Let's start with a hearty afternoon, good afternoon from Las Vegas and Austin, Texas. I'm not certain I've traveled the farthest here, but I certainly have went through the most challenges getting here, and I'm truly looking forward to sharing with you a perspective that many of you have already are believing, and that is the journey of digital health through the lens of apps. As I start my journey today and share with you a viewpoint that I hope you will look to engage in a conversation post today's discussion, where I believe the industry, working in collaborative frameworks with government, providers, other key stakeholders, can bring about a true transformation of health as a transaction to health as an experience. We've talked quite a bit the last day or so about Internet of Things. We've talked about the next new creative generation of innovation, and ultimately thinking about the impact on the patient is where I come at it. So I'm about participation. I do wear a few hats. I'm not wearing my commercial for profit hat today. I'm going to represent this from the interest of a nonprofit organization that I've started several years back, and hopefully share with you some learnings that will be a key takeaway that I hope will be insightful for you as you look at the challenges of digital health here within your respective market. Now, because I'm into participation, I'll need a little bit of verbal because I can see about half of the room, and the rest of you really don't exist. So I'm going to listen for audio. So maybe you can help me, Alicia, as I get started, thinking about this from the lens of two communities that I've spent the last about 10 years delivering value from my development companies and many of the companies that I've co-founded or founded over the last few years. One is to the left in a city that many of you might know, but I was intrigued by the fact that when I arrived here taking the tube, there was a small little advertisement in the tube attracting your Londonites to Las Vegas for your dopamine effect, and that is gaming and other things that you might come there for. Now, some of you might not know that the picture to the left is out of Las Vegas, and many of you have been there and probably haven't ventured enough from the Strip to know that that is the Brain Institute by Mayo Health Clinic right there in Las Vegas, a city known for experiences. Often, as we say, what happens in Vegas stays in Las Vegas until we got Facebook, and then we've shared that around the world. I recently relocated my family from Las Vegas to Austin, Texas, also another great community there in the Southwest, known for experiences, whether it's music, food trucks, technology. Is a city that's undergone tremendous transformation relative to how we have focused on delivering experiences and not just focused on continuing to deliver services to our end consumers or patients. But I'd like you to work with me for a moment because I do have a challenge. I'm a little bit of personal confessional here today. And that is, I'm going to admit something. I'm an appaholic. Okay, don't put that on the tweet today, but just share with you. Over the last 4 to 5 years, I've actively, have just tracked this last week, downloaded over 3,000 apps and gone through different experiential reviews of those apps and everything from social to gaming to health and fitness, finance, you name it. And I'm on a mission, as I've often been joked to by my friends, has been an appinator. I want to get rid of so many apps. It's too many. So for the audience, would you please just help me and welcome me? Hi, I'm David, and will you please welcome me because I'm appaholic. Please, hi, David. Hi, David. Whew. I'm going to share with you a little bit, please. Thank you. Now, as we get started, one of the things that I recognize is many of you have looked at apps, which is one viewpoint of digital health, as a way in which to improve engagement with consumers in the moment. Now, as we remember, there was the .com phenom, and now we've continued to evolve from early days of e-health. I was one of the co-founders who helped drive the public offering of WebMD. Spent some time here in the UK with Boots, delivering some of our content over here. And many of the companies I've either been at the founding or co-founding or senior executive level in, I've recognized there's a tremendous opportunity in front of us to move beyond the transactions that are often propagated by the Internet of Things. Great technology will not solve the ultimate challenges that we're facing from a patient experiential perspective. And as I move through the conversation today, I'm going to talk about my viewpoint of moving beyond the Internet of Things or the thing to the Internet of Experiences, which begin to create this notion of the Bridgeton effect, and that is building connections from existing touch points, using the value of digital to wrap around those experiences that supports the consumer on their journey. I literally have abandoned the use of multiple wearable sensors over the years that I've tested because most of them were not interoperable. I looked like a tethered guppy at times. Whether this sensor, this Alexa, this gadget, I'm like, my God, is the world becoming that connected that we're going to lose this notion of a humanized experience? And so as I think about moving to a world from Internet of Things to the world of Internet of Experiences, think about what happens on a monthly basis. According to Nielsen research, the average consumer goes through 25 to 26 apps in a month. Nowhere in the top 5 does health and fitness apps even exist. And somehow we're going to talk about urges, I heard from the previous speaker, this addictive effect of this mobile platform. The second greatest urge that we face in a day-to-day basis, ladies and gentlemen, we'll forget about urge number 1. Let's talk about urge number 2. And that is that tendency to reach for that mobile platform in the mobile moment. 2 years ago, the average consumer would reach for their mobile phone about 110 times per day. Today, according to Nielsen research, it has surpassed 150 reaches a day. It's quite a bit of an addictive behavior. I often refer to it as that thumbing deficit disorder that I have with apps. I'm constantly scanning through and finding the app, and most of them are not connected or integrated in a way that gives me a visualization of my experience. If you think about some of the distractions that happen every day within 60 seconds, and you look at this pie chart, you don't see a proliferation of health transactions. I'm going to share my data. I'm going to connect my steps. These are social-enabled behaviors that are daily practices that are innate to the human behavior. And we're trying to break through that as believers and custodians in this transformation by focusing on this evolution and using this new construct referred to today as digital health. Let's go back to the days of e-health, MHEALTH. We relabel things in healthcare often to make it more interesting and exciting. And now I'm going to call it digital health. But I'll give you my viewpoint on digital health through the lens of one construct of digital health, and that is not remote patient monitoring sensors, not wearables, but the world of apps, which is where my organization and teams have been focused the last 5 years. We were one of the early pioneers in the US, my organization, Social Wealth, working with large healthcare institutions, payers, and hospitals, who would help them filter through the veracity of healthcare apps that were proliferating the landscape there in our markets. I also acquired an organization, another early pioneer in the prescriptive side of digital health, working through physicians, called Haptique, in New York City, started by the Greater New York Hospital Association. Tremendous learnings I'll share with you as a perspective of apps today. Now, one healthcare institution in the US, our network had a reach of over 49 million covered lives. And one of the challenges they had was it was taking them about 8 months to integrate through their procurement process and their CISO process one app. We brought them a process through the art of curation where we took that procurement demand off of their system and created a process in which we created a curated boutique, not a marketplace. Most consumers don't want thousands of choices. 3 options around a category that we would curate on behalf of that organization. And through the notion of working with that organization, we learned that something was happening in the marketplace. I've called it APPAGEDDON. In 2014, according to an earlier slide, which referenced 97,000 apps, that was 2014. Look at where we are today, over 259,000 apps and growing. We don't have a creative innovation economy opportunity here. Folks are ideating tremendously in the area of bringing apps to bear when it comes to this notion of using apps as one construct of digital health. Now, the supply side is out of control, but let's look at the demand side. Do consumers really need another app? Or are they really looking for something that is an augmentation to existing experiential touch points that supports that experiential journey? We, I believe, are poised with having an opportunity in front of us in which we can begin to move forward with this framework around digital health curation. Someone said to me earlier, is that like creator? So no, think of a museum. I love the wonderful museums here in your town. I've had a chance to visit a few in my last couple of trips. But think of the notion of having the ability to take advantage of all the innovation that is unfolding in the marketplace, pulling those assets together, organize them around a particular experiential journey for the consumer, and presenting it just in time where it's relevant through the modality of choice by the consumer. A tremendous opportunity to focus on experiential design versus more production. I'm not a big proponent of hackathons. Weekends in which coders are hacking new creative approaches on an app. Not really where I see the market wanting to spend more time in the markets in which we're existing today. And so one of the things that we have moved forward with is this concept of where experiential design is merged with privacy and security as a way of protecting the app frontier. It's often referred to as the Wild Wild West. And we're going to talk about that because there's a challenge around the business models, the use of the data, and how these particular experiences are driving value from the standpoint. Let me walk you through a framework on how we have been successful in the last 4 to 5 years as one of the pioneers in helping large health plans, hospitals in the US, break through the veracity of choices to end up with an app boutique that is sponsored for either recommending by the health plan or prescribing by the physician. First, we look at the landscape. If an app has not even, now I'm not talking about going to get reviews that you can pay for now through social sites and get likes on your app. We've learned that trick. We looked at that early on. But if an app has not demonstrated a sustainable experience with data with a minimum of 50 consumers of a variance of different experiences, they don't make the initial scanning and cut in our filtration process. We have a lab with professional reviewers, behavioral scientists, technology officers, design scientists, data scientists, a composition of individuals and resources and functions that are all a part of the design and creation of the experience. Coders are at the end of that spectrum. Very important, but they're at the end of that spectrum in the sense of how we code. So we go through a process we refer to as experiential design review, looking at behavioral design, clinical efficacy, all the elements that truly bring the value of that app to bear relative to your role as a custodian to ensure that the design of that app is going to meet market requirements and your responsibilities as the custodian of the healthcare. Second, we take that app through an extensive behavioral review around app vulnerabilities from a security perspective. Is the data encrypted when it's at rest? Is the data encrypted as it's in motion? What we've discovered in the last 4 years in looking at thousands of apps from around the world in both the iOS and Android store, all apps are not designed or created equally. And there are significant vulnerabilities. There are no standards. Yes, in America, we have emerging standards that we're starting to introduce like FHIR, some of the interoperability opportunities around those standards. But what we realized is there was no defined standards around how to design and create an API. We've done the integration. The release of the data, very fragmented, very kludgy. And so what we recognized was the opportunity to come forth with a boutique concept in which we would present to the patient or consumer insights about that app from a transparency perspective so they can make a more informed decision. So looking at all of those design constructs, we would take these apps from a broad marketplace perspective, place them into a white label boutique on behalf of the sponsor, and then reveal to the consumer information about that app that we have curated. Each app is given a score that has been prepared by our professional reviewers. This year, we've just announced consumer panels and physician panels. So 2 additional viewpoints in looking at those apps. If a physician has not recommended or prescribed that app, we don't really take their recommendation from day one. You have to be an active, engaged participant in the experiential framework. Moving through the information, all of the data that is typically not given to you, the consumer, when we click on the App Store, download the app, most of us don't read terms and conditions. An example, we recently did a security scan of an app that in the terms and conditions, it referenced that it was going to access your microphone, your contacts, your camera, and so forth, entering the sanctity of your mobile platform called your smart device. In an example of a security scan, we realized that the app was maintaining ongoing recordings of what they call user sentiment, but it was recording one's audio conversation through the app, through the mobile phone, for up to 48 hours after they stopped using the app. Hit public news in the US. That was an alert. The consumer who was subjected to this said, I wasn't aware that the app was monitoring my audio. Most of us don't read the terms and conditions as you download the app. So one of the things we try to do to the consumer is give them a reflection of the app's design characteristics around privacy and security, in addition to the preceding areas I've just covered, to ensure they have some indication of how the app is performing around that particular curated experience. You can take a look, if you have a moment, out as an example at haptique.com to take a look at some of the apps that we have curated over the last 4 years. And in most curated boutique examples, the consumer is only presented with 3 curated choices by app category. So not overwhelmed. Whether it's a pharmaco wraparound to a drug, or it's a wraparound to a physical encounter with the physician or a chronic condition, the sponsor determines what are the experience pathways in which the consumer will be engaged in their healthcare journey. Now, one of the challenges I faced over the years in doing this as a commercial business is that we were often being critiqued by the market as having this black box on how we reviewed apps. So I said, here's what we're going to do. We're going to try to bring the industry together. We took our intellectual property, all of our methodology of curating apps and looking at apps, over 342 unique characteristics, in partnership with academia, and we created a nonprofit organization that's called Xcertia, and I'll talk about that here in a moment. What it was going to enable me to do is separate the professional software curation business from the evaluation and measurement side of the business. And it was going to allow us to move forward and put much more value around the transparency of information relative to the app ecosystem that were emerging in the marketplace. And one of the things we looked at in that design was vulnerabilities that were beginning to subject the consumer to significant risk with this value that's beginning to merge around patient self-generated data, and that's the risk of apps. Take a look at this and some of the vulnerabilities that start to come from this.
Hi, I'm with IT. I'm here to replace that network device you requested.
Oh, okay. Do you know where to go?
Oh, I totally got it from here.
All right, cool. Damn it. Excuse me, what are you doing in here?
I'm here with the IT to
You need
do
to
the
come
stuff.
with me now. Come with.
We have security risks. We have day-to-day risks that we have to contend with. Apps are a new gateway in which risks are being introduced every day into our day-to-day lives. I submit to you some stats around looking at, and we've done research over the years on behalf of our large organizations where we have to be in compliance in the US with standards like HIPAA. The US now is moving forward under the FDA and are introducing new regulatory requirements both around those apps that are clinical oriented that will be regulated under FDISA, but now they've created a new MHEALTH committee under the new FDA commissioner, and they're going to begin to look at health and fitness apps as well, and what they're going to require relative to disclosure around the patient. One area in the last work group meeting that I attended was a strong emphasis around the biggest criterion we use before an app makes it through our initial filter, and that is security. The number of apps we've looked at that did not make the cut over the last 4 years, where there was malware, delivery of data outside of the Western markets in which those apps should have been contending, where the data, patient self-generated or not, could be used for purposes that could be detrimental to the market, whether it's the healthcare sponsor or the consumer. What we've realized with the vulnerabilities of apps, that healthcare information today on the dark market has a 10x value more than financial data. It is a new micro biofuel that's going to drive value positively or for bad actors in a way that we've never imagined with all these talks that are emerging around big data. I submit to each of you that taking steps around security parameters that protect consumers both from a design perspective and from a security perspective is where we're moving in the States, and I want to share with you today what we've done. With the risk and vulnerabilities that we've discovered over the last few years, we've created an open collaborative framework. We went and found 3 leading industry meta brands in the US who could elevate this discussion beyond our entrepreneurial journey. The American Medical Association, over 100 years in their voice of the physician, they adopted in 2016 a national charter around digital health enablement, moving physicians into the realm of prescriptive digital health. Number 2, the American Heart Association, one of the credible meta brands in the US involved in vetting content for their particular constituencies. And the third, many of you may have heard of if you visited the US in the past for healthcare IT conferences, and that's HIMSS. Those 3 leading meta brands have joined the organization I started about 18 months ago. Took me about a year just to get the conversation to a level of readiness. We have now come together to form Xcertia, which is an open collaborative framework in which industry, government, academia, consumer organizations are coming together to form a framework around how we address the emergence of multitude of apps that are either sponsor-driven or market-driven to ensure the value around the healthcare experience of the consumer and their providers. This open collaborative is certainly going beyond the geography of the US. We entered into conversations over the last 24 hours with organizations here in the UK who are involved in this journey, On Mobile Health, Orca, and others. NHS was at a conference I was speaking at 2 weeks ago in Washington, D.C. with Datapalooza, and NHS has also approached us regarding how can we create a collaborative framework to bring structure around the launch, deployment, measurement, and implementation of apps in the marketplace. As we think about this framework of Xcertia, moving beyond one entrepreneurial vision, but to a framework which the industry begins to self-police itself in partnership with government, academia, the consumer organizations, physician organizations, and alike, I believe we are poised to move the value of apps to the next frontier when we begin to think about apps beyond the transaction, but apps as a part of an integrated experience. And to do that, many of the workshops that we're going to be conducting, many of the publications that we'll be releasing, we hope and we believe that it will drive these one-off hackathons to be more centered around design, which will focus on ultimately improving outcomes with health as an experience versus just another app that's stuck up in the iOS and Android store. So today I end with a conversation around digital health is not constrained by geographic boundaries. Consumers' interest around using the top 2 aspects of our day-to-day life, a mobile platform, in socializing with one another, in leaving behind micro insights that is referred to as patient self-generated data, presents a tremendous opportunity for us all to come together and drive value in this digital health movement. And so for that, I'll conclude with inviting each of you to think about where you might be able to play a role in this transformation. And let me leave you with the framework that we're launching in the 3rd quarter of this year in the US around giving consumers more transparency around an app similar to what we've done around food labeling or prescription drug labeling. We've actually taken this incredible amount of data that we've collected, and we're creating an app labeling process that each app will now have published that a consumer can go to with a quick snapshot around that app. Looking at key areas around, is the data encrypted? Are they going to access my contacts? Will they access my audio? This mobile computing platform is an incredible amount of passive data referred to as social physics. With 0 interaction with the consumer, it is monitoring your behaviors 24/7. Your location, who you text and connect with. Social physics is the next frontier as to why we believe apps must have a level of transparency through app labeling to drive greater transparency and understanding from the patient and the consumer and the physician around what the intentions are behind each app that has been designed and developed. The app labeling process we've designed and will be announcing through the Xcertia framework is going to be done in collaboration with the FDA in the US as a way of driving at the design level, at the marketing level, and at the presentation level, a level of awareness to the consumer where they can be absolutely in tune to what are the intentions behind that app beyond the transaction. We get that it supports the glucose meter. We understand that it supports the Fitbit, but what are they doing with the data? Every consumer, we believe, is absolutely poised to understand that information upfront in a very transparent and engaging way. So I submit to you, if you recognize the value of where APPAGEDDON has gone astray, 259,000 today, we look out 12 months from now, where will we be? There needs to be the elimination in some apps, but I think it's an opportunity for the industry to come together, join this framework process that's going to deploy guidelines. We have just released through the Coalition Executive Committee the 1.0 set of those guidelines. Members will have access to those guidelines and will be able to use those in their deployment, development, and marketing of their apps to the marketplace. Thanks for allowing me to share the story with you this afternoon. Thank you.